wait a minute or so and let people come into the session. Okay, so it's 7 o'clock BST, so I'm going to kick off the session. Hello and welcome to the Planetary Health Annual Meeting and Festival Side Event hosted by the London School of Hygiene and Tropical Medicine's Pathfinder Initiative. It's fantastic to be here and thank you all for attending. It's really great to see some of you. And happy Planetary Health Week. I hope you have enjoyed the events that have been happening this week. It's been super cool. My name is Amy Thomas and I lead on communications for the Pathfinder Initiative as well as the Centre on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. The title for this event is Creating Feasible and Effective Pathways to a Healthy Zero Carbon World, Evidence from Real World Scenarios, and we've got some really great talks ahead of us. I really hope you enjoy the session and get involved in the discussion. A couple of practical notes before we launch in with the talks. We will be recording this session and a link will be available afterwards on the event page, as well as being uploaded onto the Planetary Health Alliance YouTube account. So you will be able to find a recording of the session there. We also really want to make this an interactive discussion and we have plenty of time for Q&A at the end. We have half an hour to have a Q&A. So we really encourage you to ask questions in the chat function. If you please would use the chat function instead of the Q&A function, that would be fantastic. And we do have the option to unmute your microphones if you would like to ask your question directly to our speakers. If you put a note after your question and say you'd like to ask it live, we can unmute you and you can talk directly to us, and that would be fantastic. So yeah, pop your questions in the chat as we go along and we will get to them in the Q&A part of our session. So I'm absolutely delighted to introduce our fantastic lineup this evening. We have Andy Haynes, Penny Morage and Christine Belasova from the London School of Hygiene and Tropical Medicine, as well as Nicole De Paula and Enrique Barros from the Working Party on the Environment of the World Organization of Family Doctors, WONCA. And sorry, Nicole is from the Institute for Advanced Sustainability Studies in Potsdam, Germany. So first, I'm delighted to introduce Andy Haynes. Recently listed as number 28 on the Reuters list of the top 1,000 climate scientists in the world, Andy will be taking you through the rationale for the Pathfinder Initiative, which he co-chairs, and some of the initial findings of the project. So over to you, Andy.
Many thanks, Amy, for the introduction. And can I just check that you can see my screen? Great. So I'm going to say a few words about the Pathfinder Initiative, which, as you've already heard, really aims to capture lessons about what happens in the real world when groups around the world try to implement decarbonisation strategies, and more particularly, what evidence do we have that these have the desired effect on health and on greenhouse gas emissions? So this slide really summarises the problem that we're trying to address, which is, as I think everyone knows, that we're not really cutting greenhouse gas emissions sufficiently to remain within the limits of the Paris Agreement. You'll recall that the Paris Agreement talks about cutting emissions to remain well under 2 degrees global average temperature increase since pre-industrial times. You can see from this slide that current policies threaten to take us much closer to 3 degrees, which could be, in some parts of the world, absolutely disastrous and poses a wide range of health threats to humanity. I'm not going to say much about those impacts. I'm not really going to say anything about the impacts of climate change on health, but I assume that you're all broadly familiar with the range of impacts and why we need to reduce the risks of dangerous climate change. Recent projections suggest that if we did implement all the pledges that have been recently made, that we could get to just over 2 degrees centigrade. But of course, it depends really on whether those pledges are implemented. And even if they are, we'll still be above the Paris limits. You can see from this slide that in order to keep to below 1.5 degrees centigrade global average temperature increase, we need to cut emissions really very dramatically, over 7% per annum We did cut emissions last year by about 7% because of COVID, but that's clearly not a sustainable way of cutting emissions, and it's caused vast damage to the economy and to people's livelihoods. So we believe that health is a very powerful motivating force for rapid decarbonisation, and we want to amplify the messages coming out of the experiences of decarbonising the economy. The potential benefits could be very large indeed. In addition to the benefits of reducing a dangerous climate change, there are the near-term healthcare benefits from climate change mitigation. So when we move away from burning fossil fuels, for example, we can potentially avert millions of premature deaths from air pollution. One estimate, recent estimate suggests perhaps 3.6 million air pollution deaths could be averted from fossil fuel burning by decarbonising the economy. And more than that, if we take into account household air pollution and replacing current solid fuel burning with clean, renewable alternatives. Transportation also, redesigning transportation systems to make them more conducive to increase physical activity and reducing road traffic danger by increasing access to public transport, but also safe walking and cycling, particularly in cities, could also potentially prevent many premature deaths. And of course, food and land use change, major driver of climate change, about 30% of emissions, and dietary risk factors, high consumption of red meat, inadequate fruit and vegetable consumption, for example, responsible for perhaps 10 to 11 million premature deaths a year, something of that order. So very, very major potential health co-benefits, but can these really be achieved in practice? Well, only time will tell, but the Pathfinder Initiative aims to capture some of the lessons from the implementation of these strategies. It aims to capture lessons from a range of different sectors, the built environment, food and agriculture, the healthcare sector, and a range of other sectors, the transport sector as well. And the methods it's using are to bring together, to synthesize research evidence and prioritize it across different domains, and to collect case studies to see how different carbon reduction strategies work in practice. And the outputs that we'll be producing are guidance from shared learning, a high impact report in the Lancet of the Commission, which is part of the initiative, and a whole range of targeted campaigns and networking with a range of different decision makers, with the objective, the ultimate objective, of course, of improving health, meeting the net zero targets, and promoting flourishing and healthy societies. Co-chairs of the initiative, Helen Clark, the former Prime Minister of New Zealand, Chief Administrator of the UNDP, Joy Fumafi, former Vice President of the World Bank, also Assistant Director General at the World Health Organization, and currently a Director of the African Leaders Malaria Alliance, and myself. The core research team, and you'll be meeting some of them tonight, are at the LSHTM, but also with links to the commissioners from around the world. I won't read out all their names, but it's a very really impressive group of people from a range of different disciplines. And Nicole De Paula, one of the commissioners, will be speaking later. And the institutional partners are summarized on this slide. I won't read them all out, but you can see that we've got a very diverse and impressive range of institutional partners representing not just, of course, the healthcare sector, but also many other communities as well engaged in sustainable development and climate change mitigation. So the key issues that we hope to address are how do decarbonisation strategies affect health and greenhouse gas emissions in practice? And importantly, how can we finance and implement well-designed policies and technologies that can yield multiple benefits for people and planet? So we aim to identify key tipping points for rapid social change using health as a motivator for rapid action, emphasizing the opportunities and benefits of change, because we believe that this message is often more likely to stimulate and catalyze and support change than necessarily just pointing out the dangers and the risks and the potential catastrophic outcomes of climate change. So we believe that these kind of messages can help to catalyze the rapid uptake of policies, technologies, and interventions. So as I say, we're engaged in synthesizing the case studies that we receive, and we're receiving those at the very moment. We haven't got a final list today, but we are increasingly receiving case studies from around the world. We're conducting an umbrella review, which is essentially an overview of systematic reviews. So we found nearly 7,000 review articles that may be relevant to our activities. And we're currently synthesizing those and really pulling out the ones that have particular relevance. There'll probably be a few hundred of those in the end that have particular relevance that document the healthcare benefits of decarbonisation. And then, of course, undertaking also synthesis of key messages on the political economy and financing of initiatives. So let me quickly summarize a few of the example case studies that we're looking at. First of these comes from the National Health Service in England, and the NHS has has had a strategy for some years to decarbonise the NHS, the National Health Service. It's resulted in an estimated 62% reduction in NHS carbon emissions, which is quite a substantial reduction in emissions. If we look, that's in terms of its direct carbon footprint, the scope 1 and the scope 2 emissions. In other words, the energy-related emissions and those arising directly from the health service. And if you take into account those indirect emissions related to supply chains, pharmaceuticals, medical equipment, transport, and so on, then a smaller but still significant reduction of about a quarter from 1990 to 2020. So already seen substantial progress, but as you may know, the NHS has now committed itself to complete decarbonisation, even of indirect emissions, by 2045. So we'll be describing some of the progress so far and the projections in our report. But to take a rather different perspective, in Cape Town, we've come across the study there of energy retrofits in homes in Cape Town. And this is an initiative which seeks to modernize homes, existing homes, to make them healthier and more sustainable places to live, reducing the heat burden, but also employing clean and sustainable energy and more efficient lighting, solar water heaters, and improving insulation in ceilings and other in exteriors as well, making them more energy efficient. And this has saved so far about 7,400 tons of CO2 annually, and could be extended to many thousands, tens of thousands of homes with much larger potential benefits. We've also seen this interesting case study that was published in the Proceedings of the National Academy of Sciences last year. And this is a very interesting study looking at how improved rural healthcare can reduce illegal logging and conserving carbon in a tropical forest. This is in Indonesia. It's a 10-year program to evaluate the impact of an intervention to expand healthcare access for communities living near a national park where there's been much illegal logging. Some of that logging is driven by the need to raise more income to cover unaffordable healthcare costs. So this study has looked at how providing affordable access to healthcare to nearly 30,000 people has improved both the health of the community, but also reduced the illegal logging. And they've also calculated the carbon benefits. They've shown that there's a reduction of 70% compared with a control group in illegal deforestation, and thus more carbon is retained in the forests. Another example would be the example of cycling promotion in Mexico City, where there's been a massive expansion of bike parking facilities in an attempt to promote cycling for intermodal mobility, modal changes in transport, and to replace motorized journeys of 5 kilometers or less. And you can see some of the benefits of this program that have been estimated. Some of this is modeled, some of the health benefits have been self-reported. So we'll be looking to see what's happened more recently in this case study as we delve into these in-depth case studies. And finally, another interesting one was the example of sanitation. This is some work looking at the mitigation of greenhouse gas emissions from human waste. And it's showing that off-site sanitation via composting of human waste can result in large reductions of methanes, which is a powerful, of course, greenhouse gas emissions, which overall produces net climate benefits, as well as, of course, the benefits of enhancing sanitation coverage with the health benefits that brings. So this is a technology which is suitable for low-income settings, well, high-income settings as well, but can be rolled out in low-income settings because its cost is relatively modest. So we hope that these kind of case studies, by synthesizing and Promulgating some of the lessons from these case studies will hope to accelerate the ambition for rapid decarbonisation around the world and stimulate, support mutual learning, contributing to initiatives such as the Race to Zero, which is a collaboration of 120 countries, the largest ever alliance, committed to achieving net zero carbon emissions by 2050 at the latest. So these are very early results. Obviously, we'll have much more to share in the future, but now I'd like to pass on to the next speaker. Thank you very much indeed.
Thank you very much, Andy. That was fascinating, and thank you for going into all those case studies there. That was great. So next, I'm very pleased to introduce Penny Morage. Penny is a member of the Pathfinder research team and co-deputy director of the LSHTM Centre on Climate Change and Planetary Health. Penny will be explaining the role of nature-based solutions in achieving net zero. Over to you, Penny. Penny, are you there, Penny? Can you hear me? Perhaps we've lost.
Yes, sorry. Can you see my screen?
I can't see your screen. Oh, I can now. Yep, there we go. That looks good to me. Thanks, Penny. Over to you.
Yeah, thank you very much, Amy. I'll be talking about the role of nature-based solutions and their potential to propelling us to a net zero future. So starting off with a very brief definition of nature-based solutions. So these are solutions based in nature that act by enhancing nature, but also providing multiple societal benefits. And they act by protecting and also by better sustainable management of nature and restoring natural and modified ecosystems. There are very many types of nature-based solutions, and I'll only be showing examples of a few. But this graph here shows a typology of how we can begin to classify nature-based solutions. And we can think of them in three broad categories. So the first type there is where the solutions have very minimal human intervention. So an example of this is natural ecosystems that have been left intact, such as wetlands or mangroves, and where we can begin to benefit from those systems, such as in food security or preventing flooding risk. Type 2 category is where there's been a moderate intervention, human interventions. And a good example of this is agroforestry and agroecology solutions. So this is where human beings have intervened a little bit in terms of making them a little bit more sustainable, but also in improving their multifunctionality. And I'll be giving an example of type 2 solutions today. The third type is where there's been a lot of human intervention. And an example of this is where we create new ecosystems. And a good example of this is where we see in cities and in urban areas where we create a new ecosystem, such as designing green walls and green roofs. The whole idea of human benefits from nature is not new, and I refer you back to this framework. You've probably seen it before. It's the Millennium Ecosystem Assessment, which is a way of looking at the ecosystem linkages with human well-being. And it gives some of the services that we get free of charge from nature, and we probably, some of them, we take it for granted. But just to highlight that that we are fundamentally linked to ecosystem services, and we rely on them for our survival. So now going towards the opportunities of what nature-based solutions can offer to us, and just to kickstart, the first thing I want to highlight is that nature-based solutions are low cost and also sustainable. This is a really good example of that, looking at flood barriers and comparing natural flood barriers with more engineered solutions. So the natural flood barriers here are an example of using mangroves, and the engineered solutions are what you probably see in the Netherlands. The second opportunity of nature-based solution is that they address multiple sustainable development goals, and they do this simultaneously. So these are the goals that have been set to propel us to a sustainable future and also to achieve a good outcomes for everyone. They include things like no poverty or no hunger, quality, good health, and so forth. And I'll be giving an example of a solution that tries to address some of these goals. And that thing I want to highlight is that, which is a really good thing about nature-based solution, is that they enhance or they encourage environmental stewardship, which, as we all know, is good for human health. And this is something that the public health world has been engaging with quite a bit now. And it's really understanding the mismatch between the health of ecosystem and the health of humans. You can see the graph on the right there is that, taking the example of life expectancy, human health has been getting better in time, but this is at the expense of the health of natural system, and in this case, biodiversity, which has been on the decline. And so this is really thinking about the traditional public health approach that may not be suitable in the future that we're facing, and thinking about maybe more ecological public health approaches that are very similar to planetary health. So the fourth thing is the nature-based solutions capacity to reverse climate change. And we typically think about this by their capacity to decrease carbon sources and also increase carbon sink. And I wanted to highlight in particular land use solutions, especially agriculture and forestry, because they account for almost a quarter of all human emitted greenhouse gases. And one way we can start to capture that carbon in the atmosphere is by a better ecosystem stewardship, but also improvements in agriculture. I want to highlight a little bit about agriculture, and that will be my emphasis in today's talk, because we use about 40% of the land surface in the planet on food production. And that has huge impacts on and huge environmental impact. If you think about greenhouse gas emissions, but also depletion of fresh water to soil erosion and use of pesticides. So agriculture is important, but how do we start to capture that carbon from the atmosphere? So this is a really good starting point. It's a popular paper by Griscom and colleagues, came out in 2017. And what they've done is they've come up with 20 distinct solutions, they call them natural climate solutions, and they fall under the broad group of nature-based solutions. And what they are distinct conservation, restoration, and improved land management actions. And if properly implemented, they can capture about 37% of the carbon mitigation that we need to remove from the atmosphere to meet the Paris Agreement. And the graph on the right there shows you. So the green part of the graph is the carbon that's been captured by the natural climate solutions. And the gray part of the curve is what we need to remove by decarbonization. The thing to highlight is that nature-based solutions are part of the solutions, but they're not the only solution. And they can help us mitigate up to 37% of carbon in the atmosphere. I said agriculture was important. So looking at those 20 solutions, the green box on the right at the bottom of that graph shows 10 solutions that are based on agriculture alone. I want to highlight the one highlighted in yellow, trees in croplands, because it's an area I've been working on and I know a little bit about. And just having trees in croplands is the second largest cost-effective agricultural pathways. And I'll tell you more about that. So using this technique called Farmer Managed Natural Regeneration that was started, I think, in the 70s in West Africa. And it's a really low-cost way of regenerating degraded landscape sustainably. It's low cost because you don't need to buy any seeds, And typically what farmers do, they use existing trees, felled trees, shrubs, sprouting root system and seeds that are in the soil. And they regrow those and they manage them into trees. It's a form of agroforestry. So you integrate the trees and the shrubs in croplands and grazelands. And it's been really effective in restoring those landscapes. On the right-hand side, you can see a farmer using that technique, doing some pruning. But I wanted to highlight the work that's been done by two organizations who are also our research partners. So Just Dig It and the Lead Foundation. We're doing a collaborative study trying to work out what are the health benefits of the work that they've done in Tanzania, regenerating up to 6.3 million trees. So this report was produced by the World Vision International, who are a large humanitarian and advocacy charity. And they've listed several benefits of this technique, social benefits, environmental benefits, and economic benefits. But what's missing in a lot of the solution is really understanding what are the health benefits. And I'm hoping that this research study will begin to answer some of those direct and also indirect health benefits. Because as you can imagine, some of the health benefits will be linked to the social, environmental, and economic benefits. Some of the health benefits will include direct things like protection from heat exposure, to things like nutritional benefits. But also to highlight that there are some disbenefits to some of the nature-based solutions, and some of them are unintended. And so we can think of things like increases in human and wild animal conflict, but also increases in vector-borne diseases due to an increase in pests and vectors. So this is my last slide, just to conclude and to mention some of the methodological challenges in doing this work. And one of the things that we've encountered within the Pathfinder Initiative is a shortage of evaluated examples. And I think this is typically because a lot of solutions are implemented by small charities with very little capacity to do full-scale evaluations. The other challenge, which is depicted in this image, is it's really difficult to unpick the pathways to health within the multiple outcomes. And this is a piece of work that we did with the World Agroforestry Centre, trying to understand the health benefits of agroforestry. And you can see it's a really complicated picture that would involve some huge amount of data set. A lot of that data set does not exist. And the third challenge is that nature-based solutions take a long time to realize any impact or any benefits. And in closing, really the last challenge is the sort of the mismatch between public health models and ecological models that might not promote multidisciplinary study work, but that is changing quite rapidly. So I'll leave you with this final image of a hillside that has been regenerated using the Farmer Managed Natural Regeneration, and it shows you a picture, before and after picture, and this landscape is in Catalysing in Ghana. Thank you for your attention.
Thank you very much, Penny, for telling us more about nature-based solutions and highlighting some of those evidence gaps there. Next up, we have Christine Belasova. So Christine is the Deputy Director of the Centre on Climate Change and Planetary Health and member of the Pathfinder research team. Christine will be talking about the co-benefits of climate mitigation and adaptation in urban development. So over to you, Christine. Christine, you're on mute. I think you want to unmute yourself.
Thank you very much, Amy. It's a pleasure to be here today. And as Amy already mentioned, I will be talking about co-benefits of climate change mitigation and adaptation in urban developments. So to date, cities are responsible for over 70% of energy-related CO2 emissions. And in this graph, you can see the consumption side emission estimates for 13,000 cities. These estimates suggest that there is quite an uneven distribution in emissions across urban areas. So of these 13,000 cities, the highest emitting 100 cities are accounting for 18% of the global carbon footprint. So it appears that a decisive action by a limited number of local governments can help make notable progress towards meeting climate change mitigation goals. To limit global average temperature increase to well below 2 degrees, CO2 and short-lived climate pollutants would need to be reduced to net zero within the next 50 years. And some have suggested that cities should achieve this target much earlier. So on this slide, for example, you can see that C40, Cities Climate Change Leadership Group, which is a group of 97 cities around the world representing 1/4 of the global economy, they have estimated that to stay on the aspirational 1.5 degree trajectory, C40 group cities would need to achieve net zero emissions by 2030, unless negative emission trajectories are being used. And of course, to reduce the emissions, we need to examine their sources. And in cities, emissions originate from pretty much all urban sectors, including transport, water supply, food, energy, and buildings. And these sectors are, in theory, designed for urban developers, convenience, and well-being, but often they also exert pressures on the local and the global environment. And depending on how well they're designed and run, they can also pose risks to human health. But there are, of course, actions that we can take that will help reduce carbon emissions and other environmental pressures, and also simultaneously help improve human health and well-being. So let's take transport sector as an example. A recent scoping review looked at peer-reviewed and grey literature on initiatives promoting low-emission mobility. And they identified 108 initiatives globally. And in this diagram, you can see the way how they categorize these initiatives. So some initiatives are sanctions that are regulative or economic, while other initiatives are more of incentives, for example, psychological and various persuasive incentives. Quite importantly, they found that the level of evaluation among the reviewed literature is very low. Only 31% of studies provided any form of evaluation of how these incentives and initiatives actually impact on greenhouse gas emissions and atmospheric pollution, on air pollution. So sanctions such as congestion charges and restrictions were more likely to be evaluated than the softer incentives. But overall, the quality of the evaluations varied very much. So this is really a gap, good evaluation studies of actions that are taken to mitigate climate change. And this doesn't apply only to the transport sector, but also other sectors. Green urban infrastructure is a good example of solutions that can help contribute to both adaptation and mitigation goals, and simultaneously also have benefits for human health. And here in this graph, you can see how green infrastructure can help reduce urban heat island effect, producing benefits at multiple scales. And of course, there are also other health benefits of green infrastructure, such as noise absorptions, mental health benefits. Green infrastructure provides space for physical exercise and social interactions, as well as an environment that is more conducive for children's cognitive development. But there can also be negative effects of green infrastructure on health. So for example, there can be increased levels of allergies from certain tree species and potentially safety concerns depending on how the green space is designed. So a very important question is also how exactly do we design our green infrastructure and other climate change mitigation solutions so that they maximize the health benefits and minimize any potential disbenefits. And of course, one set of actions won't be sufficient for reaching climate change mitigation targets. Therefore, we need to think about packages of actions. And when we think about the packages, it is important to consider how their effects will interact. So just as with the green infrastructure, there are other solutions that can help both mitigate and adapt to climate change simultaneously. So for example, improved physical accessibility to various amenities can help people access services more easily, especially in the conditions of heat wave or a natural disaster. But at the same time, they would require less travel. And that way, it can help reduce energy expenditure and also reduce the greenhouse gas emissions subsequently. But there can also be trade-offs between some actions. So for example, compact urban development can come in conflict with the availability of space for urban parks, for opportunities for passive building design, because passive buildings do have to be positioned in a certain way and have to have a certain environment around them to perform well. So when talking about the packaged interventions, we have to ask the question, so what has been attempted at the city scale? And some of you may have heard the visionary ideas and theories of eco-cities. Masdar city, which you can see in the image, is an example of such ambition. So it has a vision to become the world's first zero carbon, zero waste city with 40,000 residents and 50,000 commuters. Its buildings would be subjected to very stringent sustainability standards, aiming to reduce the embodied carbon in the building materials, but also aiming to achieve very high energy and water efficiency. In 2006, the Abu Dhabi government announced that it will spend $22 billion to build the city by 2016. To date, only 10% of the city has been developed, and the completion date has been pushed to 2030, with funding being reduced down to $10 billion US. So it is unclear how a city like Masdar will actually function in practice. And of course, for most cities, the challenge is to transform their current infrastructure and their social makeup to meet the zero target goals. One of the best performing cities is Copenhagen. From 2005 to 2018, Copenhagen has reduced their carbon emissions by more than 40%. And the goal for Copenhagen is to become carbon neutral by 2025. But it hasn't always been a very smooth road for the city. They have had targets for 2010 and for 2015. The 2010 target was not in fact achieved, but the 2015 target was overachieved, and that set the city on a very good carbon reduction trajectory. Copenhagen has 3 climate action plans and in total 165 initiatives that have been implemented or are planned to be implemented. And Copenhagen overall exhibits a very high implementation performance. So both in terms of the changes to the energy supply and the emission reductions. And they are moving at a very impressive pace towards their net zero target for 2025. Now, there are over 100 cities that are reporting at least 70% of their electricity coming from renewables. Over 40 cities are currently operating on 100% renewable energy. Basel in Switzerland is one example. So 100% of renewable energy in Basel is coming from its own energy supply company, and most of the electricity is coming from hydropower and 10% from wind. Switzerland, as a country, also voted to phase out nuclear power in favor of renewable energy. So how can cities transform to meet the net zero target? We have done some work trying to identify what would be some of the mechanisms for such transformation. And here you can see a framework that is meant to help cities achieve urban transformation towards health and sustainability. And in this framework, we're emphasizing how important it is for the city governments, private sector, people living in the city, but also academic institutions to collaborate. And as the key mechanisms for transformation, we identified good governance, urban planning and infrastructure policies and regulations, technological and social change, scientific evidence and its co-production, as well as the behavior change. Now, many of you will know this image. This is the satellite image of one city in 2019 compared to 2020. And we can see that there was quite an appreciable reduction in greenhouse gas emissions and air pollution, probably one of the greatest that we've seen in the history in such a short span of time. So people really have drastically changed their lifestyles in response to COVID-19 pandemic. And when our habits get temporarily disrupted, we are much more conducive to new information, to adapting new mindsets, and even adapting a more long-lasting change in our behaviors and lifestyles. And cities have an important role to help us lock in these positive behavior changes that can help mitigate climate change and improve our health. For example, by setting up long-lasting infrastructure, allowing for more active travel, but also helping implement policies that are conducive for these goals. Thank you.
Thank you very much, Christine, for that positive and very interesting presentation. Next up, I'm very excited to hand the floor over to our next speaker, Enrique Barros, Chair of the Working Party on the Environment of the World Organization of Family Doctors. Enrique will be speaking to us about the critical role of primary healthcare systems in communicating and delivering planetary health. Take it away, Enrique.
So let me just start presenting. So I'm really a family doctor, and I'm going to talk about the role of family doctors in mitigating climate change and the role in planetary health. But I want to start first by showing where I live and where I practice for the past decade, 11 years or so. And this is my little town. This is a little church. My house is over here. It's where I'm giving this talk. And in between them, my clinic is down here. We have other villages, we have around 14 villages between the mountains here. And together they make up 6,000 people. So this is my ground, my research, my lab. Of course, I'm a family doctor, so I'm trying to look as best as I can for my patients. Here's some students, some interns that come to my clinic. And this is the map of Brazil. And my clinic is near Porto Alegre city, which the metropolitan area is over 2 million people. So concerning the role of family doctors, WONCA has issued a declaration calling for family doctors of the world to act on planetary health. So it's quite clear for us that we do have a mission. So the Lancet report on health professionals for a new century stresses that the core competencies of health professionals should be on the health needs and health system needs. And of course, we need to understand that health systems needs must account for the Anthropocene, which is the epoch that we're living in. And that needs to change competencies and change the assessments we do as professional educators. It needs to change the curriculum and so forth. Here's the tree of core competencies and characteristics of family doctors' practice from the World Organization of Family Doctors. So I want you to look at the right side, the lower corner, and I'm pinpointing the existential dimension of the patient-doctor relationship, which is very important in planetary health, and to understand really what is important for the patient, we need to dive into this. And many times this does come up in consultations. There's a longitudinal dimension to the patient relationship with the doctor, spanning from years to decades. So it makes a lot of sense to think of planetary health. Of course, we need to think of health promotion. And when we talk about climate change, we can think of many health co-benefits, as was pointed out by the speakers before me. And very importantly, my title in Brazil is really family medicine and community medicine. So we do have a role for the health of our communities. And of course, the communities are on this planet. We just can't separate it. And we need to account for the Anthropocene again. So how do we keep our communities healthy? Again, we go back to climate change mitigation. And finally, I want you to look at the attitude here written in red. It's really a root of the family doctor's role. And it's in red because it's an urgent need. It's an urgent attitude that we need from family doctors. Now, how do we do that? How do we do climate change mitigation in the office? Well, we need to listen. We need to listen to our patients. We need to listen to our communities. We need to listen to the planet. And if we do that, I'm convinced we will know what is needed and we will know how to do it. Now, here's a more traditional approach, perhaps more didactic. This was published by Z et al. In 2018, focusing on the role, the challenges and opportunities for primary care providers. So I'm going to focus on the upper part, which is mitigation. But of course, there's a lot of adaptation to plan for and to prepare for. So on the upper part, concerning mitigation, there are many things that family doctors can do. We can work with the energy sector, and certainly we can work with the food systems. For instance, promoting the planetary health diet, which can have a very large effect on climate change mitigation. Transport, promoting active transportation, which has been shown could protect a lot the health of our patients. We can think of buildings in that. I think of healthcare systems, pathways to net zero here, industry, and so forth. And the health co-benefits we have with mitigation are lowering air pollution, lowering noise, increasing physical activity, improving nutrition, and improving water access and quality. So this does have a huge effect. Of course, the actions are intersectorial, so we need to think of healthcare promotion and prevention, research and education, advocacy, and health system strengthening, and of course, going to net zero. That's a very important role. So to give you some practical examples, Brazilian cities, except from São Paulo and Salvador, who's also implemented, they mostly do not provide monitoring for air pollution. And it should be done regularly on a daily basis and maybe hourly, maybe in real time. And this is what we've done in Porto Alegre. So we created this, this program, started out by family doctors, but we developed our own low-cost air health, air pollution monitor, specifically focusing in fine particulate matter. So you can see the dots here, there where we have different monitors, and they show you the quality of the air in that community. And our dream, so every little ball here, circle, is a healthcare clinic, outpatient clinic. So our dream would be to have one of those in every healthcare unit in Brazil. And WONCA likes to think big. So we imagine low-cost monitors in every outpatient clinic in the world. And why do we need to do that? Well, we say that we measure blood pressure because it's good for your health. And so we need to measure air pollution. It's essential for your health. Another action that we're taking, also led by family doctors, is to raise awareness among medical societies and scientific community in Porto Alegre and region and in Brazil, and hopefully around the world, to the largest open coal mine projected to be just 20 kilometers from downtown Porto Alegre. This is just crazy. So we have estimated the amount of dust that will be thrown into the air. So it would be almost 500 kilograms per day for over 20 years. So that's probably going to harm a lot. And of course, it's just next to the place where we drink our water. So of course, we're going to have high pollution from the toxic metals present in mineral coal. And we are succeeding in this. We're aiding the judiciary and challenging the health and the economic health implications. So when you talk about money, people start to understand a little bit better. So that's one of the languages that we have to use. Now, the role of family doctors, I hope I have clarified it a little bit. We do make a lot of calls to action, and I want to have your attention to our last call that just came out about a week ago. It's on our website. So WONCA action call for COP26, and it has many points. Of course, we're aiming for net zero health systems, but I want you to look at this little point here. So we want all family medicine national colleges to endorse and promote the pragmatic, very pragmatic, by the way, healthy recovery from COVID. So this is done in partnership with Global Climate and Health Alliance and the World Health Organization. And we have over 40 million health professionals endorsing this, of course, through their representatives. So if we do have this motion going, this will have a significant impact around the world to drive change. Now, I think this is no coincidence. This morning, my wife, my kid, my 7-year-old, and myself, we saved a little hummingbird in my hand, and it flew. And our symbol of the Working Party on the environment is a hummingbird. A friend of mine said to me in one of my existential crises, well, look for signs of God, you might be surprised. I'm not sure this is a sign for God, but it does seem like a sign for God, from God. And I just wanted to finish with a little video saying where we got our logo from, which will hopefully inspire you. So I'm going to click here and hope that we.
We can't hear the sound, Enrique. I don't know if there's supposed to be sound.
Oh, you can't hear the sound?
No.
Can you hear it now?
No, I can't hear it. You might have to share the sound.
So I'm just going to stop it and I'll just tell the story anyway. Let me just, let's see how, can you just stop my presentation, please? I seem to have a problem here. Oh, I think I can do it here. Stop sharing. So it's unfortunate that you can't hear it, but it's a story about a hummingbird that is helping to put down the fire, and it brings little drops, and no one else is doing anything. And they're just saying that the little hummingbird doesn't need to do that. It's not effective. But of course, it has a symbolic importance, which as humans, we're driven by symbolic and role models. So I see myself as a little hummingbird, and hoping that we can have all family doctors and all health professionals, which are massive, putting out the fire. So thank you very much, and back to you, Amy. Thanks.
Thank you very much, Enrique, for sharing that lovely story. And we can paste the link to the video so people can watch it in their own time if they're interested in that. So thank you very much, Enrique. And finally, I'm delighted to hear next from Nicole de Paula, who is a Sustainability Fellow at the Institute for Advanced Sustainability Studies, Potsdam, Germany, and a Pathfinder Commissioner. Nicole will be talking about the political economy of transformative strategies for planetary health. I'm really looking forward to it. Over to you, Nicole.
Thank you, Amy. Let me just adjust things here. Let me know if everything is fine. Yes. I see you. So you hear me well, right?
All good, yeah.
Okay. Well, thank you, and nice story, Enrique. And, always good to hear my colleagues and get this inspiration. It's Friday night here in Berlin, and it's great to see so many people in this call. And I think we're very motivated with this Planetary Health Week. And I think we're here for a very simple reason, right? That it's suicidal what we are doing to our natural world, and the key message here is how is this striking back, right? So I really like this quote of UN Secretary General talking about humanity is waging war on nature, and nature always strikes back. So it's very interesting that we need definitely to unite forces here. And when we're talking about, I have great experts here in this group, and I'm so proud to be also one of the scientific commissioners of the Pathfinder Initiative, and we're going to have great results at the end of this year. But sometimes we tend to forget to demonstrate what are the connections there, right? When we have climate change, there are so many direct and indirect connections. I won't go in detail of all these ones here, but when you have rising temperatures, rising sea levels, and increasing extreme weather events, there's so many ways our health get impacted. For example, through vector distribution of ecology of mosquitoes impacting infectious diseases. Air quality is an example that we hear a lot, more than 7 million premature deaths every year, water quality, wildfires, and mental health. So it's also very much, I like to put this, it's about this nature crisis. And of course, we need to bring the theme of biodiversity into this narrative. And that's why I really also enjoy the notion of planetary health, since we are really trying to combine all this crisis, but not to tell all the problems that we have, but to combine and multi-solve these problems that we are discussing. And here is very interesting. Of course, now we are here virtually because of this pandemic, and there's no better time to bring these connections between human health and nature, connecting, of course, with the risks, increasing risks of zoonotic diseases, very much connected to the Anthropocene, as Enrique was saying, how our impact on nature is actually driving so many new risks. And so the solution is really not to seize that war on nature, but to undertake this restoration of nature. So it's very, I really enjoy also the talk that we had on nature-based solutions tonight. And we have then this narrative. Of course, the mission is very important, but unfortunately, what we discussed also this whole Planetary Health Week, how important it is to translate our knowledge and these models and the science to action on the ground. And it's because we still see that these narratives of well-being do not support a decarbonization of approach. And the narrative, I mean the mainstream. Of course, everyone in this call and everyone attending Planetary Health Week are very much aware that this is the importance of nature for well-being. But this, if you see the values that you see or in marketing or the way the companies are conducting business, the mainstream still tend to disregard these connections between nature and human health. So the public perception of urgency is still low, despite, of course, we're seeing this great mobilization, and that's one of the key responses of increasing social activism and building movements. And we had a conversation today in the last day of this Planetary Health Week of how important it is to have civil society behind this cause as well. It's not only a topic for scientists or academics. And of course, we need to understand the vested interests, who are those that we have to be against within this battle. So the health environment nexus has been neglected for too long. And that's, we knew, what I find also very interesting is we are seeing a bigger mobilization. However, you have many scientists who have been alerting us for maybe 3 decades, 4 decades. And we have here just to give a few numbers on this reports that we have before the pandemic, saying that nearly 25% of all global deaths are related to economic decisions affecting the environment. And of course, I mentioned the air pollution, work quality also causing more than 3.5 million deaths worldwide. Chemical exposure can cost nearly $1 trillion in neurodevelopment effects in middle and low-income countries. And that's why I was also very happy to hear today at the closing of the Planetary Health Week, how we managed to increase the number of people from the Global South engaged in this conversation, because that's where we need to have and expand the science of planetary health, of climate change in general. So what I see is that timing is everything, and I feel that we almost have the next 6 months is this moment that if you saw a rainbow, you have to run and take a photo, because really, despite the scale, the knowledge, and the urgency to tackle this transnational global challenge, we still see a lot of disconnection, a lot of fragmented responses to pandemics. It's a great example, but this is a problem of the fragmentation of action that we have to combat. So what now, right? We are in a very difficult moment. And what I find particularly interesting now is that we are not only explaining to people what it means to destroy our nature, or why do we need decarbonization in our economies, but people are feeling the crisis. And I think this brings a real window of opportunity. So how can sustainable development policies proactively and in a coherent way address this interrelated challenge? And we also learned this week, and before, we have been saying this also for decades, how the GDP tells nothing about human well-being. So it has been desired after war, a little bit of a war strategy to measure production capacity and economic growth. So, and policymakers and economists are treating GDP as this all-encompassing unit to signify a nation's development. That's how we measure our success. So, of course, it is more than time to acknowledge the limitations of GDP and expand our views for development to include welfare. So what I like to say, we need to go beyond the pills. It's really about prevention that we're trying to convince our policymakers and decision makers worldwide. So prevention, what is the language of policymakers is really jobs, resources, and in many regions, votes. So prevention is cost effective. That's one of the science that we need to get this message and spread around the world, is that, for example, here we have how preventative actions such as disease monitoring, retained forest cover, reductions in interspecies transmissions and regulation of the wild meat trade or illegal wildlife trade are estimated at 22 and 31 billion annually. And what do we see, what the type of costs that we're going to have, and we are having with the pandemic now? It's 8 trillion. I think we're now about more 10 trillion. It's significantly more than we could have spent just to prevent these problems. And I think also, Andy Haynes, you mentioned some of the cost savings that we could have if we improve our healthcare systems. There are many examples of air pollution here. A report from the UNEP saying that we could even gain $23 trillion over the long term. So we need to expand. I think that's the role of Pathfinder Initiative. We're going to expand on these case studies, get the numbers, and spread this message of the importance of decarbonization for our health. Here's also another example how we're seeing in this window of opportunity, how nature is the real antidote against vaccines, against pandemics, because we talk a lot about vaccines, and we're seeing how even the problem of the difficulty to have this vaccine equity, we can imagine it's not a real solution for everyone, how long it will take to have the whole low and middle income countries vaccinated. We know it's going to be a long time now. So again, it is much cheaper to prevent than to respond to crisis. And that was, I think, was to me a great pleasure as a Brazilian. I was very proud to have this Planetary Health Week hosted by the University of São Paulo. And this title, I'm very, it is my favorite because I think I contributed also a lot to bring this topic of planetary health for all and bring And this image really represents how if we keep putting ourselves at the top of this pyramid, we're never going to achieve any great transition. So it's really about this cohesive coherence existence with our natural world that will bring us more success. And I really like also this other, I'm also the founder of the Women Leaders for Planetary Health. And it was very interesting, again, on this topic of GDP, how another speaker during this week, Ryan Eisler, mentioned how GDP measures the wrong things. It has nothing to say about the caring economy, traditionally done by women for free in a male-controlled environment. Of course, we must value our caring system, and the pandemic could not be more illustrative of this initial recommendation here. So I do have 3 recommendations, which is one, of course, we need to invest in this adaptive capacity at the local level. And because planetary health is indeed it is a broad concept, climate change seems very big, but we know that action and transformation needs to happen at the local level. And we are seeing, when we talk about education, how important it is to creating many platforms and lectures and seminars in general, whatever we can do to bring awareness at all levels, not only at the university when you already chose your profession there, but even at the early stage in schools. And we are seeing how this transformation is happening. So again, I think COVID-19 and digitalization can give us many opportunities at this level. But also, this is, I still believe, of course, I'm a scholar in international relations, and I was, there was a commentary here at the Lancet Planetary Health that I discussed this year on planetary health diplomacy. What does it mean to negotiate? If you go to at the multilateral level, when you have your negotiators, if they're also not thinking systemically and understanding the connections between all these agreements that we are creating, we're not going to achieve much. So we definitely need also to bring these conversations of the importance of health and environment, these connections to the multilateral level, which we learned on Thursday when we had a session on this, how we cannot take for granted, specifically now with the time of this pandemic, rise of populist leaders and the pressures we are having in our societies. It's very easy to forget the challenge of the political level as well. And finally, connected to all this, of course, we need to break down the systemic barriers, which is really the root cause of the unsustainable development. And here, this is a policy brief that I also recently wrote, Gender Equality, the Formula to Accelerate the Implementation of the Sustainable Development Goals, because we still see how many solutions we have, and they are just forgetting half of the population, for example, in the case of women. So if you're going to go for projects on agriculture or smart agriculture, but in a country where women don't have access and control to land or productive resources, we know the limitations that any project would have with this type of legislations, for example. And we see also this discussion of incentives that is very important to have more support for movement building, but also with enterprises and NGOs and networks who are fostering these connections. They're not only talking about gender, they're not only talking about health, they're not only talking about environment. We need to really tackle these things together. And there are some organizations, and I think the planetary health community is very well placed to lead this transformation. And of course, we do need more women leaders driving this process. And unfortunately, when we see in the case of COVID, for example, when you have countries and their task forces, there was a study showing how 86% of these task forces are led by men. When you have 70% of women at the front lines in the healthcare responses during this pandemic, we know that there is definitely not a very balanced relationship between the needs and the policies, how these policies are being shaped. So I do believe this planetary health narrative can be very transformational, and COVID-19 gives us a chance to do that. It's a very small window of opportunity that we have now, and of course the medical doctors are a very important piece of this puzzle, but not all solutions are inside the hospital, and it's very important to have functional democracies. We learned also today how even movement building is sometimes a privilege in so many countries when we don't have the right even to demonstrate. So leaders' accountabilities and partnerships are very important. And I just like to conclude here, we do have the philosopher Bruno Latour, who gave an interview talking about if Brazil finds a solution for itself, it will save the rest of the world. So we're definitely going seeing how important it is to have healthy political systems to solve these problems. And to close with his another quote from Bruno Latour is that there is no greater intellectual crime than to address with the equipment of an older period the challenge of the present one. So I would very much be interested in continuing this conversation with you all in this call, and thank you for the opportunity to address you this afternoon. Thank you.
Thank you very much, Nicole. That was really incredible. I really enjoyed that presentation, and massive thank you again to all of our speakers. Such amazing insights from all of you, and all of you attending. It's really, really great to see you all here in the session, whether it's your afternoon or evening. It's really great to have you here. So now we're going to kick off with the Q&A discussion part of the session. We've got a question come in from Ayami for Enrique. So if Enrique can answer this, that would be wonderful. Ayami is asking, she says, thank you for the wonderful session. I would like to ask Dr. Enrique, how do you manage to engage in planetary health work in addition to seeing patients? And how do your patients think about it? In Japan, family doctors are assumed to be just focused on clinical work. If doctors would start doing planetary health, there could be many barriers. Do you need to persuade them initially? So there's quite a few points there. Enrique, would you like to comment on Ayami's question, please?
Sure, my pleasure. Can you hear me?
Yeah, all good.
Okay, good. So Ayemi, this is an excellent question. It is a recurrent question within WONCA, the World Organization of Family Doctors, because family doctors are really overburdened and highly time pressured, but mainly through longitudinal care to the same patients, to the same community. After some time, you build a trust relationship that has been studied and proved, demonstrated. And health professionals have one of the best positions to help patients and help people understand the great co-benefits of tackling or mitigating climate change. So I think I showed some of the actions that family doctors can do. And I find that my patients do have existential issues and do have health problems, and they do benefit from simple orientations like reducing red meat or going for active transport. That's something I cannot see why family doctors wouldn't do that. That's quite straightforward and has a large effect on your health. But many times family doctors just are not trained for that. So we need to correct that. And just another aspect of the time pressure, I think that economists and health economists especially should understand the high potential for family doctors and primary care providers for cost-effective actions. And I think they should measure and they should quantify cost-effective actions, and they should pay for it. We should have an extra 1 minute for the planet for each patient. So we are representing now over 500,000 family doctors around the world. Now imagine if we have 1 minute for the planet with every patient. That's significant. And I think it's possible, but health economists must also understand that. You can't pressure doctors and expect to get good health outcomes. That's just nonsense, okay? So I hope I have answered. Thank you very much.
Thanks, Enrique and Ayami. I hope that answers your question. So yeah, do put your questions in the chat if you have a question for our speakers. That would be fantastic. And if I may just continue the discussion, we've talked quite a lot about Pathfinder. The Pathfinder Initiative is hosting this event, and Andy mentioned some of the rationale behind Pathfinder and very nicely outlined some of the case studies we're looking at. Andy, you spoke about this range of case studies and areas for carbon emission reduction. How does Pathfinder plan to take this evidence out of the world of academia, to make meaningful impact beyond that?
Yeah, thanks, Amy. Well, that is, of course, a major challenge. And obviously, we need to reach out to the kind of people on this webinar. But more broadly than that, we also engage these influence partners, as we're calling them, the organizations that were on one of my slides. So these are quite diverse organizations like the Sustainable Development Solutions Network, which is a global organization that does work on the sustainable development goals. And they have a range of different networks themselves, including quite a large kind of youth presence in their network. So we're working extensively with them, with the Organization of Economic Cooperation and Development, which has, I think, over 30 nations as members. Many of those are gradually reorienting their policies towards a more of a well-being and hopefully ultimately a planetary health kind of economy, away from the metric of GDP, which, as we've already heard from Nicole, is driving us in the wrong direction. We're also working with the C40 Cities Network, which is a network of some of the world's major cities, and they have links around the world. Also with some of the smaller cities, they're increasingly building bridges with them as well. And we're seeing a lot of activity at the subnational level. So though it's sometimes frustrating to see how slowly national governments are moving, at the subnational level, there are a lot of civic leaders that are being much more ambitious in the kind of policies that are implementing. So if we can help to accelerate the pace of change at the subnational level, that could be really good. And finally, we're also working with the health care community through the Alliance for Health Systems, Health Policy and Systems Research, and they bring in the people who function more at the kind of level of the health system, and they can help to drive progress and drive the scale of change at the health system level as well. We're seeing some great work by foundations like the Aga Khan Foundation, for example, working in a number of low-income countries, and they've already instituted zero carbon health systems in a number of low-income countries using mini grids and so on, more efficient health facilities, minimizing waste, and a whole range of other strategies. So this is now beginning to occur at a range of different levels and different levels of socio-economic development as well. And I think we're always open as well to new linkages and new collaborations to really scale up this message. So we have to listen to our various constituents and learn from each other.
That's great. Thanks, Andy, for explaining that, all those great links to the Pathfinder there. Thank you very much. So we've had a couple more questions come in the chat. Thank you very much for asking your questions. We have one from Timothy Malone, again for Enrique. He's asking, Timothy is asking, in promoting the importance of planetary health, should WONCA be endorsing a One Health approach within the communities?
Yes, of course. Yes, One Health is very important. I've been following One Health framework for almost 20 years. So it's embedded in WONCA environment. The thing is, to formalize an endorsement by WONCA is not that easy. It's quite a bureaucratic process, but rest assured that it is in our hearts and in our minds. Yes, thank you.
Thank you very much, Enrique, and I hope that answered your question. We've got another question in the chat from Raphael, and this is for Nicole. Why is it critical to have women leading us towards a healthier planet?
Yeah, thank you. Thank you, Raphael. And it's very important that we have men supporting and asking questions. And that's something, you know, I was never a gender advocate before. And I think I started out of necessity. When you're seeing and circulating, now I'm aging as well. So I've seen so many of the systemic barriers that we still have for women. And it doesn't matter, it's not about planetary health, it's any sector when you circulate in business or academics, NGOs. So it is important perhaps, and I think we need to do even more research about that. But I tend to see, and when people ask that, it's not that we women are necessarily also better leaders, right? But societies that tend to accept women as leaders, they tend to be better. They're more egalitarian. And what is important also, there is one study in that policy brief that I mentioned, but just having women, that was in the United States, but just by having women at the board of companies, how there was a rise in the use of renewable energy. So we have more case studies, and perhaps the hypothesis how women are bring more of this holistic vision. The care is still a lot on the shoulders of women in our societies. So you tend to be more strategic. Yesterday on Thursday also, I was in a panel and someone said the women, they care the seeds and they are able to protect, and saying how even women in Africa were hiding seeds under their pillows to protect those seeds for future harvest. So there's so many examples out there that we need to explore. But for me, the key point is women, they have usually the responsibility, but they are not having the authority. They're not having the resources to drive this transformation. And it's just important that we have more diversity to bring all points of view together. And I hope I also gave some snapshots of the response. Thank you.
Thank you very much, Nicole. That's a great answer. Thank you. And yes, I suppose leading on from that, you know, this session is about feasible pathways towards a healthy and sustainable world. And if I may direct a question to Christine about cities, what are the key challenges that we are facing, you know, for cities to achieve net zero? What is required to make the transition? What's holding us back?
Yeah, so thank you, Amy. It really depends on the context. One city is not quite equal to the others. So in some contexts, for example, in developing countries, of course, the low financial resources can be a major barrier to implementing solutions, or even gathering people to consider what solutions are most appropriate for the context and what are the possible kind of financial sources from the outside to acquire those. In other cases, it is the political will or the leadership. So city governments may also be spread out quite thinly in terms of their human resources and may not always have the capacity to think about the wider issues. So there comes the role of someone bringing them up to speed with the global agenda and the needs and the risks that their city is facing, but also the opportunities that there are. But I think most importantly, it's really that we need to collaborate. City alone can, of course, achieve important and significant steps, but we really need to engage together. So the city government would need to engage together with the national government, as, for example, it happened in Copenhagen, because a lot of the energy transformation that happened there probably couldn't have happened without that collaboration between the national government and the city. In the same way, city governments would also need to collaborate with the private sector. It's hard to reduce Scope 3 emissions, which are rarely under control of the city government, without engaging with other actors within the city. And of course, also with academia, scientific evidence cannot be just only published in the scientific journals. I think there should be a lot more interaction and knowledge co-production together with the decision makers, with the public and other stakeholders. I hope that answers the question.
I think it did. Thank you very much, Christine. So we have no more questions I can see in the chat, but some reflections, which might be quite nice to just quickly read out, or if Rashid wants to ask or make the reflection live, we can unmute. Sarah, did she want to ask the question live, or we don't know? Or I can read it out. So we have a reflection. While in this work, considerations of finance is key, as many speakers have said, I've been increasingly thinking that beyond making business cases and talking about cost efficiencies, return on investment in terms of savings, which we have to do, we also have to recognize that in the health sector, ill health is lucrative, fueling many industries and jobs. Perhaps we ought to put some thinking into how we can identify, create opportunities for, and encourage initiatives which generate finances in promoting, supporting health and related green growth sectors as well. So that's quite an interesting point. Would any of our speakers like to address that that sort of idea of, you know, can we address this idea that we might need to support health in a more financially lucrative way? Andy, perhaps, or Enrique?
Well, I mean, maybe something for Nicole, but just a quick response. We have to realize that much of our economy is founded really on not paying the full economic costs of our activities. So there are very large subsidies, for example, in the energy sector, subsidizing fossil fuels, in the food and agriculture sector, subsidizing livestock and so on in many countries. So we don't reflect really in the prices that we pay for things, the environmental and health impacts of them. So it's partly about reorienting our economy so that it reflects the true values, the true costs of the products that we buy. And once we do that, then we'll direct the economy to much more virtuous, if you like, direction, reflecting the impacts it's having on our health, but also on the environment more generally. And that will, I think, stimulate many of the businesses that we'd all like to see flourishing.
Can I say something very quickly also on that? And of course, it's not an easy task, and this commoditization of health that we're seeing with the current system that we have, it's one of the big problems, right? So addressing, I think, Andy, you touched on the issue of subsidies. Money is out there, but perhaps it's going to the wrong places. And once we make this whole system a little bit more balanced, perhaps we're going to have better results. And I think one of the things that we're also doing with the Pathfinder is in this positive visioning, right, is finding also the cases and the positive incentives to showing this benefits and investments that are really, when you're channeling investments to companies that are destroying our resources, how is it possible that we're having more money for companies that are using water to produce beer, for example, even though we cannot survive drinking beer and without water. So I think that's definitely not an easy question, but it relates a lot to the way we're measuring the success in our economies.
Thank you very much, Nicole. And if I may just direct a question to Penny. You mentioned in your presentation about ideological differences in public health and ecological models, and thank you very much for going into the nature-based solutions. can you explain this a bit further? Does that present a barrier to nature-based solutions?
Yeah, no, thank you very much, Avi, for that really interesting question. Yeah, I think traditionally, yes, there were barriers, although that is changing a lot. And some of the barriers I can think that would prevent multidisciplinary work have been around how we think about health. The traditional medical approach is very clinical and doesn't necessarily incorporate the environment, although it is changing, judging from the Planetary Health Conference, but also from Enrique's presentation. But some of the other barriers are possibly about how, and this is more relevant to research, about how funding is allocated in terms of the research project. Traditionally, it tends to be less transdisciplinary and less cross-disciplinary, but that is changing also. So I think it is barriers, systematic barriers, but also ideological barriers. Now, what excites me about nature-based solutions is that it transcends all that. And in fact, it goes beyond traditional conservation and ecological principles or approaches, and purposely incorporates health and human, not just health, sorry, but human well-being by refocusing the debate, not just on the environment, but also the conservation world now is realizing that some of those benefits are in terms of SDGs, as I mentioned earlier, but also on human well-being. So I think it is a move, it's an opportunity for us now to sort of spread out and work with ecologists and conservations. And I mentioned in my little study that that's what I'm doing by working with those two conservation organizations.
Thank you very much, Penny. That was really great. Thank you. And we've come to the end of the session now. But thank you again for everyone who's joined and asked questions. It's been really great to hear your thoughts and reflections. And thank you again, a huge thank you to our speakers and their incredible insights. If you want to find out more about Pathfinder, you can go to our website. It's www.lshtm.ac.uk/Pathfinder, and you can find more information about the case studies there. So thank you again for attending, and we'll see you soon. Goodbye.